Well, you have heard Democratic hopefuls pushing Medicare for all as the fix for America's health care. But our next guest, a doctor and retired senator, disagrees.
He says the real disease is government's heavy hand interfering in the lives of the American people. And Dr. Tom Coburn, former U.S. Senator from the great state of Oklahoma, joins us right now to explain.
Good morning.
Good morning.
Morning to you. You know, when people hear Medicare for all, that sounds great because it's like, okay, everything's free, but it's not really.
Yeah. Well, you know, what people don't realize, there's $150 billion in fraud in Medicare and Medicaid right now. And if you look at other government-run health care programs, just think Indian Health Service, poor quality. Yeah. Think VA Health Service, expensive and poor outcomes, right? With exceptions. So that isn't the answer. The answer is to have a national policy that says we want to work on disease prevention instead of disease treatment. We want to make sure everybody can have access plus quality. We want to incentivize excellence. Why is it that every doctor that does the same procedure gets paid the same even though the quality is different? I mean, you know, what that does is dumb down. So we have no price transparency in markets. You don't know, 90%, 89.6% of all health care is non-emergent, non-mental health. You don't have any idea what you're going to pay before you go in. There's no price discovery. There's
You're
no
right. It's absolutely crazy.
Right. So we could come together as a nation, left and right, and say, what should be our goals? And our goals should be that everybody ought to have access and good quality care.
Everyone wants good health care.
Sure.
But when you have these politicians that are running for office that say Medicare for all, we keep hearing the question, how are we going to pay for it? And when you talk about all the fraud already that's in there, then they want more of our tax dollars, our hard-working money, to throw at a problem that...
Well, they're just saying we're going to copy what everybody else is doing, except everybody else rations throughout the rest of the world. They won't recognize that as a downside to it. So, you know, in a lot of countries, if you fall and break your hip at 75 years of age, you don't get it fixed. You know, you're over. You know, you may eventually recover from that, but you don't. They don't spend $8,000 giving you a new hip.
You just lie there with a broken bone until it heals itself.
So the fact is ideally, what we should have is everybody should have access and great care. And those are policies we can get behind. Sure. Everybody can get behind that. So how do you do that effectively? And you do that with price transparency. We can save, the studies show, between $400 billion and $1.2 trillion a year if, in fact, we had price discovery and people making choices based on walking with their feet to where they get the best value and the best deal.
Sure. Well, people in Washington need to be talking about that and not the other stuff. Senator, Doctor, thank you very much.
Thanks. Thanks for having me.
Go to conventionofstates.com, press the button, sign the petition. More importantly, get 10 of your friends to do the same. When you sign the petition, then that sends a letter to your state legislator. You go on the list in their district as a supporter. We deliver those lists to the state legislators. It means something to them.